is focused on the counseling process with clients who are tasked with making end-of-life decisions. This production is being narrated by myself, Sha-Toria McCoy-Gregg, a counseling student at Mercy College. I would like for you to focus your attention to the 7 learning objectives listed here. At the end of this presentation, you should be able to understand the counselor's role in helping a client navigate through the end-of-life decision-making process. You should be able to describe the dying process as it pertains to the client's phase of grief. You should be able to identify who is affected by the dying process and the types of decisions they must make in preparation of end of life. There will also be an explanation of therapeutic approaches the counselor could use in the counseling process for end of life decision making. And towards the end of the presentation, you will find the ethical, legal, and professional considerations for the counselor during this process, while also summarizing the client-counselor relationship. First, let's look at the counselor's role during this process. As the client is going through the process of making decisions regarding end of life, the counselor is to be a source of knowledge and support. Sufficiently, the counselor should listen to the client's dilemma, inform the client of the circumstances, and encourage the client to make a plan and put it into action. By listening to the client, the counselor provides an environment where the client can be forthcoming and free to express themselves. The counselor should be listening actively and observe all behaviors during the session, so they can help the client further explore their feelings effectively. After listening to the client, the counselor should inform the client of the realities of their circumstances. There are clients who may not want certain information disclosed to them, such as time frames for life expectancy or alternative treatment, that may conflict with their cultural beliefs. It is important for the counselor to respect the client's wishes while keeping an honest and open line of communication. Communication is an integral aspect of counseling and will be vital when providing encouragement to the client. The counselor should encourage the client to take control of their decisions during the end-of-life process. The counselor should communicate independence, ownership, and willpower to the client as necessary tools to navigate through the end-of-life decision-making process. The counselor should be aware of all factors involving the dying process and how it may affect the client's decision-making. The client is faced with making decisions about money, how they would pay for treatments, funeral arrangements, or the debt they amassed. They could be consumed by the question of what happens after death. Feelings of anxiety, states of depression, and stages of grief may afflict them. There is the matter of how one's health is declining and how this process affects their legacy, family, and relationships with others. All of these factors can be overwhelming during this process. The client has a range of emotions and concerns. It is important the counselor pays close attention to their own feelings, as well as counseling the client, and to be mindful of the potential for transference and countertransference. Struggles with making end-of-life decisions, the counselor should recognize any stages of grief the client may be experiencing. To help with recognizing these stages, the counselor is expected to promote dialogue that is client-initiated. This means allowing the client to be revealing of their dilemmas first. The counselor recognizes they also play an integral role in the client's decision-making process and should monitor how they themselves are affected and not impose their own values and views onto the client. There are, there are many others who are affected by the dying process and the decision-making process. These include the person who is dying, the caretaker of the dying individual, friends, family, the counselor, and the healthcare team. Counselors should be aware of the affected individuals in order to help the client. The counselor will primarily encounter two types of clients concerning the end-of-life decision-making process. These two types of clients are the dying client and the caretaker client. These clients will come to the counselor as they have pondered questions about themselves, like, why is this happening? Or, why is this affecting me? The counselor should be cognizant of the challenges the client faces so they are equipped with techniques and strategies to aid in their decision-making process. The counselor must consider how the caretaker client could be affected. Here is the results from a Japanese study involving surrogate caretakers of home care patients and their readiness to make end-of-life decisions. Their readiness seemed to be impacted by how informed they were through patients' wishes and responsibilities of the doctor. Death affects everyone in some way. It is a part of the seasons of life. Death can be instant or expected. For many, the dying and decision-making process can bring about a sense of grief. We grieve when drastic change in our lives occur and causes trauma. According to Kubler-Ross, there are 5 stages of grief. When we lose what we hold dear, the 5 stages of grief and loss are denial and isolation, anger, bargaining, depression, and acceptance. People who are grieving do not necessarily go through the stages in the same order or experience all of them. The person who is in denial of one's death tends to isolate themselves and wants to carry on with life as if the death did not happen or the person is still alive. They isolate themselves in an attempt to evade the reminders of a person's death, be it verbally, from family members and friends, or of the sight of their belongings. Anger can surface when an individual grieves, as they may feel upset because of the sudden departure. Anger may also be attributed to feeling a sense of guilt or abandonment. A client may show anger resulting from a state of confusion, like when putting pieces of a puzzle together that do not fit, so it's hard to see the big picture. Bargaining a loved one's death may be a coping mechanism for some clients, as to find justification and comfort in an individual's timely or untimely passing. Finding correlation between a departed individual's death and maybe old age or illness is a sign of bargaining of the grieving person. There is also the chance of the grieving person falling into a state of depression. It is in this state the individual's mental health is most vulnerable. The client may allow the end-of-life process to weigh them down like a ball and chain. The stage of acceptance is reached when the grieving person comes to terms with the death of their loved one and their most basic ways of life and well-being as a whole is no longer conflicted. The effects of grief can last a lifetime. It is through the support of others and the determination of self to hurdle through such an ordeal. It is important to continue with life in a positive manner. Those who are tasked with making end-of-life decisions may find keeping the memory alive of a loved one or reflecting on one's own enjoyable experiences is therapeutic throughout the grieving and planning process. Clients may raise the question of how long does grief last? Well, for the counselor, there isn't a clear-cut time frame to answer this question. However, the length of time an individual grieves is a unique experience, one that has its own pace. What is also unique is the responsibilities of the client who has come to terms with the end of life. At this time, the counselor should help the client focus on tangible decision-making goals. These goals are advanced care planning, coping, and estate planning. Advising the client to explore advanced health care planning is important in preparing them for any unexpected medical crisis. This comes in the form of collaborating with the necessary medical personnel to establish an advance directive, also known as a living will. It is a legal document that authorizes doctors or designated representatives to act on the behalf of the client in the event they become incapacitated. The client may also be an individual who was designated as the healthcare proxy, also a decision maker. The counselor should discuss with the client ways to cope while making these trivial decisions and collectively devise a plan to act as a guide for the client. The counselor will inquire about support systems, cultural perspectives, and physical limitations. The counselor will want to also talk about estate planning. Some people refer to this as the last will and testament or the dying will. The counselor will ask about assets, life insurance, and personal sentiments. The client may already have an idea about how this would be handled or may ask for the counselor's knowledge of these things. The counselor should also be prepared to encounter the client who has the responsibility of being the power of attorney for a person's estate seeking guidance in the end-of-life decision-making process. In order to effectively help clients with this process, the counselor should be equipped with several approaches to assist them. I will focus on three types of approaches that align the end-of-life decision-making process. They are conversation analysis approach, existential humanistic approaches, and the solution-focused grief therapy approach. The conversation analysis approach it was developed after conducting 5 analytic studies. It is focused on developing effective communication when discussing death in and of life. This approach seeks to identify the communication dilemmas between the dying person and their families and healthcare team, which may incite debates regarding the concept of death. It also focuses on the attention to details where the counselor strategizes design and word choice used in conversation. The counselor also provides a favorable conversational environment, which provides an inviting environment for the client's self-disclosure. As the counseling relationship develops, the counselor can use calm psychotherapy, which is suggesting alternative perspectives of the end-of-life dilemma. Next, we will discuss counselors' use of existential approaches. These therapeutic approaches focus on helping the client explore meaning of life, encourages optimism, and compels self-actualization. They are existential therapy, person-centered therapy, and gestalt therapy. Existential therapy allows the counselor to help the client to reflect on who they are and give meaning to it. Person-centered therapy, also known as client-centered therapy, was developed by the humanistic psychologist Carl Rogers. This allows the counselor to help the client establish a sense of self while providing an unconditional positive regard, which is a more empathetic approach. While Gestalt therapy is more confrontational, it was developed by psychoanalyst and psychiatrist Frederick Crowe and allows the counselor to help the client self-regulate and focus on the decision-making in the present tense. Solution-focused brief therapy is a postmodern approach. It was developed to help clients make and reach goals in small amounts of time. This type of therapy is question-based, goal-oriented, and generally consists of 6 brief stages. Quoted by Patti Smith, "Those who have suffered understand suffering, and therefore extend their hand. Well, extending hands to uplift another is at the foundation of what counselors do. Making end-of-life decisions is universal, although the approaches vary in the case of the individual and cultural and societal normalities. It is the expectation that all counselors strive to empathize with the client. Whichever therapeutic approach the counselor deems suitable for the counseling relationship, they should inform the client of their expectations and also maintain the usage of their micro skills to help in the relationship's development. The counselor should attend and actively listen to the client's feelings and attitudes regarding having to make end-of-life decisions, as well as be observant of their body language and at all times encourage them to continue open dialogue. Thus, the counselor is able to relay the expectations they hope to work closely on with the client, like coping mechanisms and stages of grief. In addition to the counselor's approach to counseling the client, the counselor must always consider their ethical, legal, and professional responsibilities. These considerations are always present when a counselor is in practice. Following the ethical code set forth by the American Counselors Association, abiding by the city, state, and federal laws, and maintaining the standard and expectations of someone in the counseling profession are all crucial aspects of the counselor's responsibilities in the counseling relationship. Counselors' ethical considerations span from the client's right to autonomy to treating clients with limited capacity. The counselor may face the dilemma of planning a course of action for a client who has questions regarding physician-assisted suicide, also known as euthanasia. The counselor will have to make sure they provide accurate information synonymous with the law in a particular jurisdiction. Consideration the topic of euthanasia. The counselor may have conflicting views of the client. It is important they remain professional in their opinions and their responses should be free of bias. Although these considerations may seem to be black or white from surface view, as the counselor delves deeper into the sea of the client's dilemma, they will find determining whether an action is right or wrong, legal or illegal, professional or unprofessional, rests in a murky gray area at times. The overall end-of-life decision-making process impacts both the client and the counselor. The client is impacted by the challenges of making these daunting decisions while dealing with the emotions of the dying process in real time. The counselor is impacted by the end-of-life decision-making process as they must remain ethical and professional while trying to help through a difficult process, while also following the law and not self-disclosing information that can do more harm than good. Definitions of death have been the topic of numerous debates, subjected to cultural factors, social conditions, and the diversity amongst the medical world. Many believe that death is a transition between many manifestations of life. Others view death as a natural process. No matter the position, it is a part of life, and preparation is of the utmost importance. Accepting death and getting things in order, such as a living will, burial plots, etc., are some tools to aid in the preparation process. End-of-life decisions are important to the field of mental health counseling, as it is something that most people in the world are tasked with dealing with. It is universal, it is relevant, and it is necessary to the client's preservation of mental health. Understanding the dilemmas and challenges a client faces as they make end-of-life decisions can help advance the knowledge, awareness, research, and preventative techniques in the lives of all who traverse the seasons of life.